Hi, everybody. Today, the topic of this video is how to deal with doctors and health insurance, which is actually one of my very favorite topics to discuss. Not really. If you are a caregiver or any person who has ever had to deal with your doctor's office or an insurance company about a claim or a benefit, you know what a nightmare this can be. And it can also be super frustrating. There actually is research out there. There's a Stanford study by a gentleman named Jeffrey Pfeffer. And the study talks about the time and the cost spent by people who work having to get on the phone and deal with doctors' offices and insurance companies. And the cost of this study resulted in an estimate of $21.5 billion of lost time, aggravation, and frustration, with about 50% of that time actually being spent by employees during their working hours because, of course, insurance companies are not available outside of 8 to 5 a.m., depending on where you live. I'm Pamela D. Wilson. My website is PamelaDWilson.com. I am a caregiving expert, advocate, and speaker. Please click on the links below to like and share this video. Also, please comment, as this helps these videos reach more people who are looking for hope, help, and support about caregiving, aging, and all these topics. There is a lot of help over on my website, my blog, my podcast, The Caring Generation. I have a caregiving support group on Facebook. It's called The Caregiving Trap. There are online courses, articles, lots of helpful information on my website. So in this video, we're going to talk about three things. One is making sure that you get the care that you need. So this is access to care, but it's also an understanding of what care are you getting and why. Number two is understanding your copays and all that kind of stuff. Unfortunately, that involves talking to your insurance company. And then the last one is what I call being smarter than your doctor's office. So we'll talk about all three of these things. So let's talk about first just the frustration, right? On any given day, you can just want to like pull your hair out because you're calling the insurance company and the person who answers the phone can't help you. So when you run into that, the first thing you want to do to start saving yourself time is saying, hey, if you can't help me, can you transfer me to a supervisor? Is there somebody else I can talk about? The other thing I recommend is if you're trying to talk to your insurance company and they're giving you kind of like the runaround about your doctor's office, ask the person on the line to make a three-way call to call somebody in your doctor's office. Now, the thing is, you need to know who they need to talk to ask them to initiate that three-way call. Get all three of you on the phone, talk about the issue, see if you can resolve it. And when you're doing this, make sure that you document your notes. The day of the call, the time of the call, the length of the call, the names of the people on the call. Ask if there are reference numbers in the insurance company's file for the call. Ask the same thing of your doctor's office. The only way to get through all of this madness is to document everything. And please never give up. I know it's just a horrible experience that people have to go through, right? And unfortunately, it makes people give up. It makes them not want to seek medical care because the experiences with these insurance companies are so ungodly awful. There's no other way about it. It's just the way it is. And so you have to really be persistent and just keep going and keep calling until you get what you want. So other things that can be difficult. So if your doctor's ordering tests or blood work or something, don't just go along with it, okay? You want to be able to understand why they're doing the tests and why it's necessary, because this is your health that they're dealing with. And it's you who has to pay the copays. And it's you who has to take time off work if you have to go to a lab to get blood work. It's you investing time in caring for yourself, which is a really good thing, and you want to do that. But you need to know why you're doing it, and you need to know what the benefit is. And the doctors have to explain that to you. Now, the problem is, and you may know this, but doctors' offices, they are so rushed, they want to get you in and out. And that's because of requirements by the insurance company who's saying you have to see so many patients in a day, and we need you to document your time, and you have 10 minutes or 15 minutes. All these doctors honestly are under so much pressure that they dread going to work every day because the insurance companies, they're called payers, right, are making them do all these things. And so they're so busy trying to do all these things for the insurance company that they neglect the person in front of them who they are supposed to be taking care of. Now, there are rare doctors, there are very good doctors out there, but still they're under a lot of freaking stress. Okay, so then we get into the number two of like paying for healthcare and understanding your co-pays and your deductibles and all of that, which is enough to drive people crazy too, right? Make sure that you understand your plan benefits, and you can always pick up the phone. I know we don't want to, right? But pick up the phone, call the insurance company, say, what's my copay for a doctor visit, a specialty visit? What's my copay for this medication? Is it the least expensive medication I can get? Now, hint, when you're at the pharmacy, if the medication is super expensive, ask them if they have a drug discount card. If the answer is yes, ask them if they can run it through the drug discount card. In some cases, you may be shocked to find out that that drug discount card, the payment that you have to make, is less than your insurance company. So this is where understanding the financial aspects of insurance can be really good for patients. Again, unfortunately, it takes time. But the more that you understand the costs and everything, the better you can manage your care and make decisions about, well, do I really need this test? What are the benefits? Then you become in control of your health rather than the system and the doctors and the insurance companies taking control. Now, all of this is super important if you're caring for an aging parent or even yourself. If you need, MRIs or CT scans or blood work or colonoscopies or mammograms or bone density exams, you want to make sure that you understand what your insurance company considers to be preventative versus diagnostic or routine, because there is a difference in what they pay. And you do not want to go and have something done and then get a bill in the mail that surprises you. Now, here's the problem. For better or worse, there are people who do nothing but coding and billing in doctor's offices. Some of them are awesome. They're amazing. They're very good. Some of them are honestly horrible. And this is where it affects the patients, right? Because if you call your doctor's office and you say, oh, is this routine or diagnostic? And they give you an estimate. And then when that gets over to your insurance company is like, oh, no, this is not routine or diagnostic. This is $1,000 test. So you actually, unfortunately, want to call both people. You want to call the doctor's office, make them give you an estimate, call the insurance company, have them get you an estimate. And when you're doing that, ask for the diagnostic codes and the CPT codes and the billing codes and the procedure codes. I know way more than you want to do, but if you don't do that and if you don't start asking questions, you may get a shocking bill and not understand why you got it. Now, if it's simple things, probably not a big deal, but the more expensive the procedures, you definitely want to ask. You want to get things in writing. Again, document the day, the time, the phone call, who you talked to, get things in writing, have them email it to you so that you know. This is part of being smarter than your doctor's office, especially when they send you to outside services. Because the problem is if they don't code it right and it gets to the outside service, and the outside service, like the lab or the imaging center or somebody codes it differently, you're going to have an insurance nightmare that will take you months to fix. Now, I don't want to make it sound so negative that insurance companies are a hassle to deal with, even though they are. They can be the best thing that happened to you, right? If you need surgery or you need care and your insurance pays for it and it's all done right, it is amazing and it is truly a blessing in disguise. But if you're a caregiver, the more that you have to deal with insurance companies, the more you have health issues, the more your parents have health issues, you will realize that this is not an easy thing to do, which is why you want to document everything, okay? Why that is super important. Because later on, if you have a problem or something happened, you can go back and reference your notes. The next video in this series is going to be how to complain against an insurance company. And so if you don't have all of this information, if you don't have dates and phone calls and paperwork that you've saved and all that kind of stuff, and you want to complain about your insurance company, you're going to have a really hard time doing that if you have absolutely no information at all. So again, be very careful working with insurance companies in your doctor's office. You have the right to ask what things cost before, make those phone calls, talk to people, make sure that you understand. I'm Pamela D. Wilson. Again, please like, share these videos, comment below, let me know what you're thinking, ask questions, I will respond. This helps my videos on YouTube and it helps more people reach information that they need. Again, go over to my website, PamelaDWilson.com. A lot of helpful information there for caregivers and aging adults, education articles, my podcast. There are over 800 videos here on my YouTube channel. So I thank you for being here and I will see you all again soon in another video.